Hey guys, so today I'm going to be talking about all the stuff that needs to happen before you can actually start chemo. So, first of all, I would just like to say right up front that initially when I remember I had a meeting with my oncologist, and I think it was the first appointment, and he kind of mentioned a bunch of things that I'm gonna have to do. It really stressed me out, and everything just felt very overwhelming, thinking of everything all at once. Getting a diagnosis of lymphoma is enough to deal with already, and so then when you hear all these things, it was really stressing me out. And then once I kind of started to schedule things and get things going, what I found really helped me not stress so much was only to think about the very next thing coming up, and that's it. And then once I did that and checked that off, only think about the very next thing. And so I was able to do it, and then everything was done, and then I could start chemo. And now that I'm in the chemo process, I can say that actually I feel less stressed out than I did before starting, because now it's like what's happening, exactly what's next, everything is planned out, and you feel like you're already in motion. The plan is already going, you're already in treatment, so everything's going well. That's the goal. You want to be treated, right? But before getting there, it was kind of stressful. So my advice is, again, not to think of everything all at once, and just focus on one thing at a time, and do it and move on to the next thing, and just keep doing that until you're done. So with that said, I'm going to talk about the things that I had to do. So once you get a diagnosis of really any cancer, the next step is to stage the cancer and see how widespread the disease is at that point that you're diagnosed. So that's done using a PET CT scan. So I had to do that. So that is a combo of a CT scan, which will show your internal organs, and the PET scan. And what that means is that you get an injection of this radioactive sugar prior to going into the scan. So I got that, and then I had to sit for an hour and just not do anything so that it could get absorbed. And then you go into the scan machine, the kind of donut looking thing. So while it does the regular CT scan, it also will pick up the radioactivity that sugar is giving off. So cancers are gonna eat that sugar much more than regular cells, so they're gonna show up really bright on the PET scan. So it's actually really cool when you overlap those two scans, because you can see where the organs are and what exactly is lighting up. So I did that, and I had lymph nodes around my tonsils, mouth area showing up really bright, and a big conglomeration, if that's a word, a big thing in my chest, which was 8 centimeters. That's the biggest mass, and that was a big bright spot here. Other than that, this lymph node was removed, so otherwise that would have lit up. But that PET scan places me at a stage 2, which means that there are several different lymph node sites, but they're all on one side of the diaphragm. So all of my lymph node sites are above the diaphragm. If they were on both sides of the diaphragm, above and below, that would have been stage 3. And if they had spread outside of the lymphatic system, so into the bone, for example, that would have been stage 4. And stage 1 is just limited to one area. So I am stage 2A, and the A means that I don't have B symptoms. B symptoms are fevers, weight loss, and night sweats. So with that, my chemo plan is a treatment plan called ABVD. That's an abbreviation for 4 chemo drugs. So the A stands for adriamycin, or generic name is doxorubicin. The B is bleomycin. The V is vinblastine, and the D is dacarbazine. So it's 4 different chemo drugs, all given on one day, and it's given every 14 days. So one cycle is 1 month long. So one cycle has 2 chemos in it. And my plan, as far as I know right now, is 6 cycles of ABVD. So 6 months, and at 2 chemos each month, that would be 12 chemos total. So, so that's the PET scan for staging. I'm gonna have another PET scan after 2 months of chemo, and then I believe at the very end. So it'll be really interesting to see the change. One other thing about the PET scan is just that there's some eating restrictions prior to doing the scan. So the day before, I could only eat high protein, low carbs, so basically greens and meat. And then for the very last 12 hours up to the scan, you couldn't eat at all, but you could drink. So that's just to limit the amount of sugar that you have in the body, since you're getting that radioactive sugar. So that's the PET scan. Next, I had to get a port placed. That's this bump thing here. So what that is this bump thing is sewn into the muscle under the skin. This was another surgery, but it didn't take too long. And then it has a catheter that is fed up into the vein that goes into the heart. So basically, that just can stay in there for years. And this is the point of access for my veins. So there's no more poking around, which is great. So basically now all they do is they take a special needle called a Hoover needle, and it just goes right into the port, and then it's just taped down. And then everything, all the chemo, any medications, it just goes right in there, and it feeds right through the catheter, and my heart just disseminates it throughout the whole body. And they also take blood from here to do the labs. So it's just a one and done poke. Super easy now. Like I said, no more fishing around in the veins, poking around, you know, a million times. That is so annoying. So I'm so happy that I don't have to do that each time. The port makes it really, really, really easy. And as for the initial needle poke, it doesn't even hurt. So it's so much easier than traditional blood draws or just, you know, vein punctures. So it's a lot more convenient, but also it's much safer to use a port as opposed to the veins for the chemo that I'm getting, because 2 of the chemo drugs are what's called vesicants, which means that if they were to come out of the vein, they would cause, basically, they would burn the tissue. And my oncologist said that that would be a plastic surgery emergency if that were to happen. And so he will not even administer the chemo unless you have a port. But like I said, having it now and having had the experience of getting medications through here, it's really so much easier. So I can't imagine if I had to be poked each time for chemo. I mean, your veins would probably just kind of die by the end. So other than the initial surgery the day of, and you know, the couple days of post-op pain, otherwise it's really easy. So I had to get that. Then there are 2 tests that I had to do as kind of baseline testing of organ function. So I had to do pulmonary function tests, and those are basically a measure of how well your lungs are working, because one of the chemos, the bleomycin, can cause lung injury. So it's important to just make sure that your lungs are okay before starting. So that was a pretty easy test. You just go and like breathe in and breathe out really hard through these tubes, and breathe in some gases and breathe out, and it just, yeah, measures different parts of like how well your lungs work. And then the last test I had to do was an echocardiogram of the heart. And that is because another chemo, the doxorubicin, can cause heart damage. So again, it's making sure that your heart is healthy enough before starting the chemo. And again, that's an easy, non-invasive test. It's just basically an ultrasound of the heart, and that's it. So those were easy. Actually, those are all the tests I had to do. So now to talk a little bit about the chemo regimen itself and kind of what they told me before starting, just to be aware of. So basically, in terms of side effects, they told me that the main things were fatigue and neutropenia, which means your white blood cells will fall. So that places you at an increased risk of getting infections. So they told me it's super important for me to avoid infections to the best of my ability. And I had to get a thermometer, and you know, they said, make sure you call us if you have a fever, because that's gonna be very serious, basically, because my immune system is depressed from the chemo. So basically, I can't eat sushi, but that's not a big deal. And just, yeah, try to avoid getting sick, wash my hands, use hand sanitizer, avoid sick people if possible. And another side effect that they warned me of was hair loss that does happen with this chemo. They said it would go at about 2.5 weeks after starting, which actually I'm at right now, but I still have my hair, so we'll see. But knowing that, prior to starting chemo, I cut my hair short, and I donated it to Wigs for Kids, so at least someone else can benefit from it. So it used to be, I guess, kind of long. I had 12 inches donated, and then since here I have more hair left, I had 8 inches donated. But so far I'm quite liking the short hair. It's so much easier and faster and cooler now that it's summer. So hopefully I can keep it for, I don't know, as long as I can, but what will be, will be. So those were the side effects that they warned me about. Of course, nausea, but I get a lot of pre-meds before the chemo to prevent that, as well as pills for afterwards that I can take. Another issue, I guess, that is an important consideration when having any kind of dangerous drug like chemo is fertility and whether it will impact your fertility. So that was a question that I asked the doctor, and he told me that with this regimen, the ABVD, it's not, it shouldn't really impact fertility very much. There's always a chance, of course, so there are options of preserving fertility, like freezing your eggs. I elected not to do that, and I didn't want to delay starting chemo, and especially if he thought that the risk is low and it wasn't such a huge concern for me at the time. So that was what I chose to do, but of course it's very personal choice for everybody. Lastly, one other thing that I feel like I had to kind of tie up loose ends with was with work. So that was a little stressful too, because I felt like, okay, I need to take some time off. I'm gonna start chemo. I don't know how I'm gonna feel. So I had to sort that out. So what I ended up doing was taking 8 weeks off for medical leave. So I'm still on that, and I have about 2 weeks left. So then I'll be going back to work, and I'll be working almost full-time. Obviously, I'll miss the days for chemo and maybe 1 or 2 days afterwards to kind of give myself a stretch, but otherwise I'll be going back soon. But filling out those forms, getting in touch with everyone, sorting out my schedule, those kind of things, making sure that my benefits are still coming in, I'm still gonna be paid, all these things. that was also kind of stressful at first, but luckily that all worked out. So yeah, so it's good now. So that's pretty much all the stuff I had to do to get ready. After that, it was basically just, yeah, I was ready to start. Just had to schedule, my first visit, and I was really nervous about starting chemo. So I also tried to just, work on my mentality and just have a positive attitude and try to, reduce the stress and stay positive. So I think that's gonna be an overarching goal until the very end and beyond, really. It's just important in general. So that's about it. And then I started, and now we're in the process. So like I said in the beginning, I think it's actually less stressful now because at least you know what's up next. You know what you need to do. So it's good. Things are moving along, and yeah, that's it. So I'll see you guys next time. Bye.